Mula sa Asian Community Development Council, ito ang Fil-Am in Focus. Mondays at 12 noon, right here on PHLV Radio.
Go ahead, Mike.
Magandang hapon po sa inyong lahat and welcome to another episode of Fil-Am in Focus, a program by the Asian Community Development Council or ACDC wherein we discuss issues, challenges and opportunities, and even successes affecting Filipino Americans. Ako po ang inyong host, Edelweiss Rivera Solano. May is National High Blood Pressure Education Month, and today's episode is about raising awareness for a critical issue facing the Filipino community that affects more Filipino adults than you might think. And today, we welcome Anansa Go, a nurse practitioner with Archwell Health. Anansa was born and raised in the Philippines and moved to the U.S. after nursing school. She finished Master of Science in Nursing, Family Nurse Practitioner at Charles Drew University of Medicine in California. She practiced in several states before settling down in Las Vegas to raise a family in 2016. And also today, she believes in taking the time to develop a relationship with patients and says good health management is founded on trust and communication. Anansa, welcome to Fil-Am in Focus.
Well, thank you. Thank you for having me. I really appreciate it.
Oh, maraming salamat din. Anansa, what is high blood pressure?
So high blood pressure is obviously when your blood pressure is higher than normal. Mm-hmm. So what is considered, high blood pressure? So anything over 130 over 80 is already considered high blood pressure.
Mm-hmm. Is there a difference between hypertension and high blood
it's
pressure?
It's practically the same. It's just different terms.
I see.
Yes,
okay, kasi may confusion around that terms
Mm-hmm.
Mm-hmm. And then also there was a study published in 2020 by a group of researchers at UCLA and Brown University, and they found that of all Asian subgroups in the study, Filipinos appear to be in the worst health and with a higher prevalence of high blood pressure, asthma, and also heart disease. And why do you think these chronic diseases, especially high blood pressure, are public health diseases among our kababayans, the Filipino community?
Yeah, so, high blood pressure is pretty common among the Filipino community. Like if you know of someone, a fellow kababayan, if you ask them, do you know of anyone who has high blood pressure or hypertension? Most likely they will say yes. Mm-hmm. There are several risk factors that put you at risk, for developing a high blood pressure. And when you really come to think of it, 1 in every 3 to 4 Filipino adults have high blood pressure. So there's really that need for interventions to prevent and manage high blood pressure in the community. So with May being the National High Blood Pressure Awareness Month, I think this is the best time to really raise awareness among the Filipino community, especially with our loved ones.
Mm-hmm.
Yeah.
And why is getting high blood pressure under control need to be a priority?
Well, because high blood pressure could be dangerous. You might have heard people saying, sabi nila, high blood pressure is a silent killer.
Yes.
Yeah, because most of the time high blood pressure does not present with obvious symptoms, but like I said, it can be very serious. It can lead to negative health outcomes like heart attack, stroke, and other serious health conditions.
Mm-hmm. And you mentioned it does have most people with high blood pressure do not really have do not have symptoms.
Yes.
And it is also less common in children. But how would someone know if they have high blood pressure?
So I mentioned a bit earlier, that there are several risk factors that can predispose an individual to develop high blood pressure. And I guess being aware of the risk factors, you can be more proactive in managing your blood pressure because some of the risk factors are modifiable, which means you can do something about it. But some risk factors are non-modifiable, like you mentioned, it's more common in the elderly because age is a risk factor. With advancing age, the risk for high blood pressure also increases. Another risk factor that, you cannot really modify is family history. You can't change your family history. So if you have a brother, a sister, a parent who has high blood pressure, that increases the risk for you developing high blood pressure as well. And there's several factors that you can modify, risk factors that increase your chances of developing high blood pressure, like weight, for example. Being obese increases your chances of developing high blood pressure. Your diet can, put you at risk if you eat a lot of sodium in your diet, especially with us Filipinos, mahilig tayo with the seasoned food, right? We have certain dishes that contains a lot of salt. And I've seen members, in Archwell Health, we refer our patients to be as our members. So I've seen members who, have, come in with high blood pressure, come to find out that the diet is really high in salt. So those, we can discuss later maybe on how we can manage, high blood pressure with lifestyle changes. Other risk factors would be that would put a person at risk for developing high blood pressure is like physical activity. So if you're the type of person who lives a sedentary lifestyle, you don't do a lot of physical activity, that puts you at risk for developing high blood pressure as well.
So when eating, especially sinigang, we usually eat we complement it with fish sauce.
I
so
know, yeah.
At least modify it in terms of lessening fish sauce, or when we add salt into our cooking, we should lessen it. Is that how we do it?
Yeah, so, talking about lifestyle changes, like I said, a lot of these risk factors you can do something about, your lifestyle. And one is limiting the salt in the diet, right? So let's say the sinigang, for example, So a lot of us, most of us think, that the salt, majority of the salt in the diet comes from the salt shaker or from the salt that we add in when we cook. But a lot of times it also comes, most of the time it already is contained in the pre-packaged processed foods that we eat. So let's just for example, the sinigang, right? There's a lot of sinigang mixes, right? So it's better if you really kind of cook from scratch instead of using the mixes to flavor your sinigang. So if you and if you do add salt, keep in mind, a low sodium diet is about 2.5 grams per day. And when you really think about it, 1 teaspoon of salt is already 2.3 grams of sodium. So being aware of that can really help you, manage your blood pressure and overall health in general.
I see. Yeah. Okay, so if one's high blood pressure is caused by lifestyle factors, the steps to prevent or avoid those risk is to lower the salt intake, among others, and also just if you mentioned about minimizing your sedentary lifestyle is by exercising.
Yeah.
And how about can you recommend any relaxation methods to lower also the blood pressure?
So we talked about lowering the salt intake. I want to kind of expound a little bit about physical activity, because the recommended activity is not really much. At least do 30 minutes of physical activity each day, most days of the week. And with that one, you don't even have to do it 30 minutes at one time. Especially if you're just starting and you've lived a really sedentary lifestyle, 30 minutes at one time might be too much, So, break it up. Maybe you do walking, 10 minutes in the morning, maybe another 10 minutes around lunchtime, another 10 minutes in the evening. So that makes it more easier and doable for you. As far as relaxation techniques, for example, a lot do yoga for relaxation, but one thing might work for someone but does not really translate to everyone. If let's say watching your favorite teleserie relaxes you, right? That could be a stress relieving thing. You can do that, but you can actually also combine your stress relieving activity with some physical activity. So let's just say you watch a 30-minute teleserye, Mondays to Fridays, right? So let's say you have a treadmill at home. So why don't you be on the treadmill while you're watching TV? So you're kind of like relaxing, but at the same time, because you're enjoying your teleserye, right? But at the same time, you're doing some physical activity. So there's no really, I would say, an exact, level of exact specific activity or even exact, diet. Apart from the general recommendations that is out there, but do something that that is doable. Do something that you will be able to stick to. A plan that you'll be able to stick to, because with these lifestyle changes in managing high blood pressure, consistency is key. So let's say today you watch your salt intake, but tomorrow you did not, right? Is that going to make any much of a difference? Not really. So consistency is key.
Well, also consult with your provider when doing so.
Yes, definitely. For like managing high blood pressure, so if you're already on high blood pressure medications, like let's say you already have a diagnosis of high blood pressure and you're already on taking high blood pressure medications, make sure that you do take it every day as prescribed, consult with your healthcare provider. If you are having, you're feeling some symptoms that you think might be a side effect of the medication, just make sure that before you stop taking the medication, consult with your healthcare provider. Because some of these high blood pressure medications cannot be stopped abruptly. It has to be tapered off slowly. And I think touching base with your healthcare provider periodically would be a good idea to manage your, high blood pressure. Yeah.
See. And as a provider for Archwell Health, how do you work with your patients to manage their blood pressure?
With Archwell Health, the provider patient ratio is well below the normal or the national average. So that ensures that as a provider, we are given adequate time to spend with our members, so which is a really good thing because we are able to address their health concerns, but at the same time provide education. Because a lot of times, we do things because we don't know better, right? But if we are educated about it, we have the guidance, somebody spends time with us to really explain to us why we are doing this, why you need to take this, you're able to participate more and be more involved with the care.
And that's great because there's individualized education that you provide to the patients
Yes,
at Archwell.
yeah.
And can you tell me a little bit about Archwell?
Yeah, so Archwell Health, we provide a value-based care approach, providing higher quality of care and a more personalized care for our seniors. So just like you said, because it's more personalized because we are able to spend more time with them. Our goal is to empower our members to live healthier lives. And currently we have 5 centers that are open here in Las Vegas, but there are 3 brand new centers that will be opening by the end of 2023.
And where are you currently located?
So currently I am in the central location.
I see.
There are several locations across the valley. We do have a website, and you can look at the different locations. If you want to touch base with us, you can just walk in, a center, and there's member consultants there who can, tell you more about Archwell Health, give you a tour of the center.
I see.
Yeah.
Okay. And every time anyone who visits a clinic, their blood pressure gets checked.
Yes.
So what do blood pressure numbers mean? It always boggles my mind, but it is explained by the nurse. But can you expound on those numbers?
Yes. So when you go, get your blood pressure checked, they'll give you 2 numbers, right?
Yes.
Typically, they would say a number over a certain number.
Yes.
Right. Okay. So the upper number is called the systolic blood pressure, which is the blood pressure when your heart contracts. The lower number is referred to as the diastolic blood pressure, which is, the blood pressure when your heart relaxes. So, like I said, high blood pressure, when you have blood pressure 130 over 80, it's already considered high blood pressure. Okay. However, you might wonder, you know what? I went to my primary, my healthcare provider. My blood pressure is like 132 over 80. But I was never prescribed a medication. Should I have been prescribed a medication? So there's different stages of hypertension, stage 1 and stage 2. 130 over 80 would be, stage 1. Stage 2, if it's like over 140 over 90. And typically that's when your healthcare provider will put you on a medication if you've already made those lifestyle changes that we talked about and there's no improvement, no matter what you did, it didn't really help. And then that's when your healthcare provider might consider putting you on a medication. And it's we talking about lifestyle changes again. I really think that as if I were the patient, you have such power over it because you get to decide, what to eat, what to do. What you eat and what you do does create a great impact in managing your blood pressure. So as a healthcare provider, I really feel like educating my patients, which in Archwell we call as our members, regarding that, because I feel like with that they have the power to really make a change. So and live healthier lives. That's what we aim for our members.
And it's also important to get an annual physical exam.
Definitely. So I definitely recommend everyone, when you're young or old, seek, preventative care. So seek primary care. Look for a primary care provider. See them at least once a year, even if you're feeling good overall, because so you can get preventive screenings. Like I said, like high blood pressure, for example, you don't have obvious symptoms, right? So the only time you'll probably know if you get it checked or if it's too late that it has already, affected certain organs and you're experiencing complications already. So why not, be proactive and get your, like a wellness check every year.
Yes.
Yeah.
Does Archwell Health accept insurance?
So Archwell Health is focused on providing primary care for seniors. So
For seniors.
yes,
I
so
see.
we only, that's all we do. We love our seniors. So
Yes.
yes. So our patients are from like 60 and older on specific Medicare Advantage plans. Yes.
So I'd like to remind everyone also kung wala po kayong health coverage, ang ACDC po ay may programa, Health Navigator program kung saan tumutulong sila na magbigay ng health insurance enrollment. So tumawag lang po sa ACDC o i-visit ang website which is acdcnv.org at may mga state licensed health navigators to help you with finding health coverage. At the same time, pumunta rin po sa archwellhealth.com at para matulungan din po kayo ng mga kanilang mga providers. At just to wrap up our conversation, Anansa, do you have any advice para sa ating mga seniors para sa kanilang kalusugan?
Yeah, so the biggest piece of advice, and I'm actually reiterating this, for me, especially for my parents, for example. My parents are elderly, they're seniors already. What I want to emphasize is, get preventative care, okay? Get preventative screenings, that could help you live a healthier life overall.
So again, get preventative screenings,
care, yes.
Eat properly, exercise, and lower your salt intake. Anansa, again, thank you for joining us today. And maraming salamat po for listening and watching Fil-Am in Focus, a program by the Asian Community Development Council. And for more information about ACDC, please visit our website at acdcnv.org and follow us on our social media channels. Abangan po ang aming susunod na episode hanggat sa muli. Maraming salamat!